Thank you very much, Stephen Bide, for that wonderful update from the All Taxi Park, where he was talking to some traders and how they are coping with the effects of the coronavirus economically. Now, economically, the death toll, not economically, but the global death toll from the coronavirus is actually surpassing 3,100 deaths as it is right about now, with 97,000 confirmed cases in over 60 countries. Indonesia also confirmed a case. You also have Senegal, Algeria, Nigeria, and some 6 other African countries right there, including Morocco. So I have in the studio a very good expert, that is Mr. Atek Kajirita. Atek Kajirita is an incident manager for COVID-19, which is also the novel coronavirus, as of February 2020, and he joins me right now in studio. Very good morning.
Good morning to you.
So how are we doing this?
We just have to do it.
Just like this?
Yeah.
Okay, that does it. So, a very good morning.
Good morning to you. Good morning to viewers.
First of all, the viewer would like to understand. Let's first things first. We've been talking about the economic crisis because of the coronavirus, the countries that have been affected. So how do you protect yourself? And first things first, how is the virus spread?
Okay, the virus, just to start with, we don't have coronavirus confirmed case in Uganda. So viewers need to know that, Ugandans need to know that. We don't have at the moment. And 2, how is it transmitted? It is transmitted by droplet transmission and contact transmission. Droplet, I mean that if somebody sneezes, then those drops that they sneeze. If somebody coughs, the droplets that you are able to inhale, or they may touch on your surfaces, the ears, the eyes, the nose, or the mouth. So those are the droplets. But again, it can be transmitted by contact. Contact, like your hand shaking. Okay, somebody has been sneezing in the hands and then you are shaking. That's contact. You can get the virus. 2, 3, you can also get the virus by touch, contact with the contaminated surfaces. So if somebody maybe had put a hand here, or they are sneezing, or contaminated surfaces, and you touch, or the doorway, the doorways, and all this, then you are likely to get the virus. Because you touch here, then you touch the eye, then you touch the mouth, things like that. So those 3 major areas, points, is where the virus can be transmitted.
So that's, yes.
And then the contact.
And then the contact. Yeah. And also the experts were telling us, even after someone has sneezed, moved away, and you still come sit in the same place and touch places where the pathogen might have landed, you might still get infected. Is that right?
Yeah, that is the contact now I'm talking about. The surface
not just
contamination,
the person, but
not
even the surface.
The surfaces. So if I coughed here and maybe there are droplets on this table, then you come and touch, then you are likely to get the virus, because you have contaminated your hands, and if you don't do the hand washing, then most certainly you'll touch your eye or the nose or something.
Besides hand washing, what are some of the other preventive measures Ugandans can take?
We want the Ugandans to really, thank you so much. Apart, we are saying no hugging, we are saying no hand shaking. That one, no hand shaking, please. No hugging, no hand shaking. They need to wash their hands regularly with soap. Soap can do well. Or these hand sanitizer, alcohol-based hand sanitizers, they will kill the virus, and you will be free if they are really in your hands. We are telling people to read they should not be in a place where if you find maybe somebody has flu-like symptoms, is sneezing, is coughing, please take a distance, like 2 meters away from the person. Okay, so that these droplets do not reach you. If you are taking care of people who have flu, you also need to have some masks. And also, if you have flu, you have cough, you should also have some masks and protect the others. We also are telling people, those who are traveling, you can delay the travel. If you are traveling to China or some of these highly affected countries, you can delay the travel, because you don't know the people you will meet and stuff like that. And if you must travel, then you should really take very serious preventive measures. So we want the Ugandans to really be on the forefront and protect themselves. Yes. And have the mask, but we are not encouraging people to have masks at the moment. No, unless you are sick, call us very immediately. Be at home and protect the nearest people near you.
Does the government have the best treatment capabilities, just in case we registered our very first case?
Yeah, the government, we are doing preparedness. We are in the phase 1 of the preparedness. We have a response plan, which is actually scenario based. There are 3 scenarios. When there is no case, when we have a case in a geographical location, and when we have multiple cases now. So we are now still in the phase 1 of no case. Okay, and so the capability is there. We are at the moment preparing all these health facilities, especially the regional referrals. And in Kampala we have Naguru and Entebbe Hospital, which have been really built. I mean, like we have put capacity for HDUs, that is high dependence units, where we can even do intensive care should we get very severe forms of these cases. So the capacity we are really mobilizing, we are building, and we feel that we are much more stronger.
Some experts contend that government is not ready, especially the regional referral hospitals that are in the far-flung of places, just in case of a contagion spreading through all the districts in Uganda. They contend that these medical institutions do not have the requisite resources to actually contain the pandemic, just in case it makes its way to Uganda.
Yeah, but we also need to know by just statistics that 80% of these cases will be mild cases. Okay, not everybody will get corona will just immediately go into severe form and die. No, 80% will be mild cases. Then the remaining 14% will be severe forms, and then the other percentage, maybe 6, will be in critical condition.
Are we saying that the people who are prone to the coronavirus are those with underlying health conditions?
Not only that, but they are most likely the people who are aged, most likely people with other comorbidities, like you have another underlying situation, maybe you are sick, you are immunosuppressant, and then those are likely to get more a severe form of the disease, compared to a big percentage that will get really mild cases, and we can manage with our facilities. Yeah.
Do you think the novel coronavirus COVID-19 has the magnitude to surpass the deadly H1N1 pandemic of 1918 that killed more than 50 million people? And right there, because we also witnessed 40 years later in 2009, it mutated into the swine flu from the Spanish flu, killing some scores of people again. Do you think right about now, even as it has surpassed the SARS severe acute respiratory syndrome of 2002-2003, do you think the coronavirus right now as it is, 3,100 people killed, do you think it has the magnitude to kill more people than the Spanish flu of 1918?
Yeah, I don't think so. It's very impossible. First of all, we have to see what has changed since 1918 to now. A lot has changed. A lot in terms of development, in terms of research, in terms of really technology, in terms of all these things. So we wouldn't expect this coronavirus to really come and kill 50 million people. Impossible. That's impossible. But it may not kill people, or may not cause more harm to the people in terms of health or public health, but may affect the economy to a level that you can't even think about. So the danger is more actually now, apart from the public health aspect, the danger is to the economy, that it can crumble the economy in the shortest possible time. How? Imagine if you have cases now in Kampala, how many people would risk to come to Kampala? Okay, how would people move? People are moving in taxis, people are moving in the buses. Just one person coughing in a bus, everybody will run out of the bus. Okay? What about the schools? Look at the prisons, look at the military, look at the refugees. We have 1.4 million refugees. How would you contain the situation in refugee setting? So it brings that pressure. That the moment you get cases, you for example, you cannot maintain that downtown Kampala when you have a coronavirus. You have like 20 positive cases there, then in the next day you'll be having like 300 cases. So it brings that, and immediately you find you are shutting down most of the systems, and then you're affecting the economy.
Can we borrow the leaf of Japan and close all the schools? Is that possible? What is the worst case scenario? What are you looking at, just in case?
The worst case scenario is when we have multiple cases in different regions of Uganda, and then we have to take really drastic options including like closing of schools, closing of maybe of these main transport systems, closing of these markets where really highly congested markets, and you know our markets, and that will really have a very huge impact in the long run. Very shortly you will find people are not able to move. Companies, if you have people here in NTV, they have to remain at home. They will not come to work. So that is what we are looking at, and wouldn't want to go into that.
Actually, Twitter asked its employees Monday to actually start working from home, to stop coming to the company offices and just do their work from home to avoid the spread of the contagion. But then in Wuhan, where the deadly coronavirus started, we were calling it the Wuhan coronavirus, but now it's just the COVID-19 because it's a global pandemic. Now, back in Wuhan, when it was discovered around 1st December, the very first patient was from a seafood market, Nuongdo seafood market. Yes. So what happened was some doctors tried to blow the whistle. Yes, but then they were suppressed. Dr. Li Wenliang was part of that group, but then they were suppressed, and the leaders came out and told the public, you know what, officially there is a virus, but we are working to contain the situation. They cut off the seafood market, the source of the contagion, and then they told the public you can continue with your normal lives. So instead of containment, people started living their normal lives as usual. So the spread continued to go ahead unabated. Do you think if the Chinese authorities had actually started the containment, the lockdown earlier, we would have cut this problem and it would have stayed in Wuhan where it started?
Yeah, it is. You know, all these things have implications. Also, getting one case or two and then you alert the whole community, global community, is also not nice. You also need to get the information very correctly. You see how the social media runs the things and stuff. So I cannot defend the Chinese government. Neither would I want that information should flow just without really due diligence. So I don't know how long it took them, but the information we have technically is that these things started late December, and by January then the cases multiply as quickly as possible. Even if you are hiding, it becomes a little bit difficult for you. And I think and we really have also to thank the China, the measures they have taken over from that time to now. If you look at the cases now, the incidence cases, then China has fewer cases compared to the rest of the world now.
Because of the lockdown in Wuhan now, and Hubei.
They had to lock down, they had to put a lot of measures, they have really been slightly so much open, and we really appreciate the way how they have handled this time.
You really appreciate, but the human rights organizations are not appreciating. I've seen some of the videos, people forcefully being ripped out of their houses, thrown into vans and taken off to undisclosed places. Even if you just have a fever and they come test and your temperature is above, it doesn't matter if it's COVID-19, they'll take you and put you together with other patients who are already at high risk. Now, aren't you infecting people who are not even having the disease? No,
we have to look at the scenarios they are handling. They are handling, I think, the worst scenario, and when you are handling the worst scenario, there are some measures that you take that will be really against maybe these human rights and stuff like that. Take an example, if Kampala was heavily affected, then we say nobody should go to Kampala or leave Kampala. We are not taking these measures for the purpose of maybe making people unhappy and stuff. No, we are trying to protect the majority of the people. By locking down Wuhan, you are protecting the whole world. Because you see the first cases were all the imported cases from Wuhan, just spreading the whole world. So you must lock that area, completely lock it, and put in measures, stringent measures, by the way, not just wishful measures. No. We test, you have a fever, we must verify. They do verification, they test, and then they take another action. It's not just like they will get somebody and just dump and stuff like that. I don't think so. Even in Ebola, they did that in West Africa. You really have to take stringent measures and make sure you're on top of the situation.
The problem right here from the experts is the slow response, especially from the experts, even the World Health Organization. They came up 3 months after the epidemic had been declared in China to just call it a global health pandemic.
Yes.
And that is the same thing in 2009 with the emergence of the swine flu. It was detected in April 10th of 2009, but the World Health Organization came out in June to announce a global health emergency. Do you think such global experts are to blame for the fact that they are slow when it comes to response?
Yeah, if you look at COVID, you appreciate that the China Health Commission declared this, actually was able to confirm this on 31st of December. The moment they confirmed, of course they have a high technology, they were able to quickly do genotyping and even shared the genome
after a month.
But that was in December. And it took one month actually for WHO to declare this as a public health emergency of international concern. Because it was declared on record on 30th January 2020. But also there are processes. There are processes that you really have to consider. You not get maybe 2,000 cases and then you say this is a public health emergency. No. Declaring it a public health emergency of international concern, it means that you are alerting the world that, hey guys, this problem we have here is not a problem of China. It's a problem for the whole world. And you are telling the international bodies, you are telling the partners, donors, and countries themselves that, hey guys, we have a problem. The problem has come, it's not even knocking, it has come in now. And we must do whatever it takes to contain it.
Do you agree with the Director General of the World Health Organization, Dr. Tedros Adhanom, that the coronavirus is far worse than terrorism?
It depends on how you really look at it, which angle you are looking at it.
He was really scared when he was saying this.
I think he was scared. He was scared because not that he is fearing, but he has the responsibility of health for the whole world. So you know that terrorism may be localized, but this is a situation that is coming into a pandemic that's affecting everybody, regardless of whether you're a big man, small person, anybody. And it brings the impact as quickly as possible, that you are crumbling the whole systems, and then you can really become the whole big catastrophe. I think that was the scare.
Even the experts from the United States do not even know how the coronavirus evolves, how it mutates, how it behaves once it attacks the body, or how it kills a person. So we do not have any information with regards to how the coronavirus comes into play. So experts contend that it could be with us until the end of this year, into the next year. What do you envisage?
No, it's a new virus, yes. It's a whole new situation. But like other viruses, it depends on how we really handle it. If we handle it in a manner that we are not able to contain it in the immediate possible time, then it will lag on for a period of time. If you look at this Ebola in Congo, just yesterday, Congo had the capacities to contain 9 outbreaks of Ebola in the shortest possible time, like Uganda. But what has happened to this Ebola? It has taken over 2 years because of some other underlying situations. Okay, so long as those are not tackled, then you will have this disease take long. And this is what can happen. But ideally, the disease actually affects the lungs. You just inhale it most often. It will attack the lungs. The moment it reaches in the lungs, then it makes so many of the other viruses itself. It has the capacity to make so many of itself. And then in the process, when your response mechanism now will come in full swing. And when they come in full swing, they again disorganize themselves and end up even eating you. So it really disorganizes that whole system. And
the Center for Disease Control has actually come out to warn that this pandemic might start spreading into communities. 3 people are spreading to 3 more people, who will spread to 10 more people, and the whole community might be affected in that regard. How prepared is Africa? How prepared is Uganda? What are we doing to contain community spreads?
I think that's a very valid worry. But for Uganda, we are a bit lucky. We are using a community-centered approach, like we have done before for Ebola. We focus on the communities. We give the population the information. We tell them what to do. And the Ugandan people have been very, 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 very good. I just want to use this opportunity to really thank them. They will move very quickly. They will do whatever it takes, and they will prevent and protect themselves. The moment the communities take it up on themselves, and the families, the people themselves and the families, and then the communities, then forget about all these things. It will move, because it is all about protecting ourselves. And then it will be off. Because to me, if I get it, then I protect myself first. I call the medical workers. I remain in my room. I protected my mouse and whatever. I'm not getting it to my children. And then it's not spreading. And that's the principle, the major principle of it. And we have relied on communities, and we have shined as a country because of having a very, very active community responsiveness.
You've decided to use the Ebola response mechanism. Do you think it will work with the coronavirus effect?
Yeah, the Ebola mechanism, we are just leveraging on the existing structures we have built over time that has helped us fight Ebola. We have different structures, we have different mechanisms, and we cannot just now starting making new things. No. All these things, basing on communities, we are now using innovative ICT mechanisms, and we are enhancing our surveillance. And these have been built over time, and they can still deliver on this.
Ateka Jirita is an incident manager of COVID-19 as of February 2020, tasked by the Ministry of Health in that regard. The conversation has been centered around the coronavirus and the effects on the economy and a lot more. Thank you, many thanks for having made the time to speak to us right here on Morning at NTV. Can you do that again?
Yeah.
Yes, for the people. A fist bump is the safest way to do it in that regard. Let's take a very short break. I'll return with your birthdays as we wrap up the show.